Hi, I'm Caitlin.
Hi, nice to see you, Caitlin.
So what brings you in today?
Well, I've been having some problems. Like everything seems super cloudy. My eyes are really sensitive to light, hence the sunglasses. Uh, I'm seeing like halos. Colors aren't super vivid anymore. And I don't understand what's going on.
And have you been having any blurriness?
You know, now that you mention it, my vision does seem a little more blurry. I'm having to lift things up closer to read them.
Okay. Any headaches at all?
Well, I feel like that's just life. It's a constant headache, so
That's understandable. Life is hard these days. Have you
yeah.
had any trouble driving at night?
Oh, I don't drive at night. Oh, no. No, it's too hard to see in the street lights. Just put a big halo on everything.
Okay.
I don't feel like it's safe.
Well, the doctor will be in soon and he'll tell you what his opinion is about what could possibly be going on, and then we'll go from there, okay?
Thank you so much.
Thank you.
Thanks, Kate.
Hello, Elise. I'm Doctor.
Hello, doctor.
How do you feel today?
Well, I was just explaining to Kat that I'm having some problems with my vision.
Okay, please explain.
Well, I explained it to her. Everything is really cloudy. My eyes are super sensitive to light. Everything kind of looks dull, like colors aren't as vivid. I feel like I'm colorblind.
You feel like you're colorblind?
Yes. Thanks.
You're welcome. Well, we can do a few tests to check your vision.
What kind of test?
First,
I'm not doing the puff of air. It's not going to happen.
First, we'll do the puff of air. Next, we'll do a visual acuity test.
Is that where I read the letters?
Yeah, they're right here.
Okay,
Look.
there's a problem with
Look!
The visual acuity test uses an eye chart to measure how well you can read a series of letters. Your eyes are tested one at a time while the other eye is covered. Using a chart or a viewing device with progressively smaller letters, your eye doctor determines if you have 20/20 vision or if your vision shows signs of impairment.
Next, we will dilate your eyes so we can look at your retina.
And what is that going to tell you?
If you have something wrong with your retina,
Oh, okay. What do you think the problem could be?
I think you're blind.
Oh. Well, wouldn't a new prescription take care of that?
No.
Oh. Am I always going to be blind, doctor?
Yeah.
To prepare for a retinal exam, your eye doctor puts drops in your eyes to open your pupils wide. This makes it easier to examine the back of your eyes, the retina. Using a slit lamp or a special device called an ophthalmoscope, your eye doctor can examine your lens for signs of cataract.
All right. Last, we're going to do the split lamp exam, and it's the most important. And we're going to shine a light into your eye so we can examine the front part of your eye. Check if you have cataracts.
Oh, is that what we're looking for?
Yeah.
The slit lamp examination allows your eye doctor to see the structures at the front of your eye under magnification. The microscope is called a slit lamp because it uses an intense line of light, a slit, to illuminate your cornea, iris, lens, and the space between your iris and cornea. The slit allows your doctor to view these structures in small sections, which makes it easier to detect any tiny abnormalities. All right, Elise, there's some lifestyle modifications now that you've been diagnosed with cataracts that we're going to have to teach you. First of all, you may not drink any more alcohol. Thank you. You must wear your prescribed glasses or contacts. You must stop smoking. And you need to wear a hat in order to reduce glare and bright sunlight.
Does it have to be this hat, though?
It has to be that hat.
Hi, Elise. I'm Samantha, one of the nurses here at the office, and I came in to talk to you about your results and some options.
Okay.
Okay. The results of the tests that doctor did with you indicate that you have cataracts that are significantly impeding your way of life. Does that sound accurate?
That sounds about right.
Unfortunately, the only way to fix this one is surgery. Have you considered cataract surgery?
There aren't medications that I can take before?
So what's going to happen is that you are going to be under anesthetic. The doctor is going to take out the cloudy lens that is not allowing you to see so well and
Okay.
put in a new synthetic one that will allow you to see much better.
Okay.
The surgery usually lasts about 10 minutes, but you usually are less groggy from the anesthesia after about half an hour.
Okay, what do I need to do to prepare for surgery, Sam?
The doctor's going to prescribe you some antibiotic eye drops just to reduce the risk of infection.
Okay.
If you're taking any anti-inflammatories or any alpha-1 blockers, they're going to need to be stopped about a week before surgery to prevent complications with bleeding.
Okay.
And the alpha-1 blockers can cause damage to the iris.
Okay, I
And-
definitely don't take any alpha-1 blockers, and I'm not a fan of
I was
NSAIDs.
not thinking that you would.
Perfect. What happens after surgery, Sam?
So after surgery, you're going to need to avoid rubbing your eye, exposing it to any like dirt, grime, or grit. So having protective glasses on is a wonderful idea.
Oh, okay.
You're going to need someone to drive you home because you shouldn't drive within the first 24 hours.
Okay.
Although just a few hours after surgery, once you're up and alert, you should be able to do some light TV watching, computer work, take a shower.
Okay, what's the recovery time?
Generally, people recover pretty quickly. The doctor is going to probably keep you on the antibiotic eye drops
Okay.
and might, depending on the amount of inflammation, prescribe you an anti-inflammatory or a beta blocker eye drop just to keep the pressure down.
Okay,
There's going to be a follow-up appointment the day after
Okay.
so that he can evaluate for complications.
Okay. How many medications will I have to take?
Just the ones I've mentioned.
So 2 eye drops.
So there's the anti-infective eye drop
Okay.
and the anti-inflammatory.
Okay, perfect. I think I have a good understanding now. And how soon are we going to schedule this?
The doctor has availability in about 2 weeks.
Okay. Thank you.
So we will get you set up with a time.
Is there anybody that can tell me what causes cataracts?
Absolutely. And she will be in to talk to you shortly.
Thank you so much.
Hey Elise, so I heard you had a couple questions about what exactly a cataract is.
Yes, I had questions. This seems pretty scary. So can you tell me what causes cataracts?
Of course, I'm sorry it's scary, I know. Doctor didn't do very much to ease your worries.
No,
but,
doctor was not very personable.
They tend not to be half the time.
That's true.
But so pretty much a cataract is, there's certain things that keep the lens of your eye crystalline and clear, and such as the proteins and enzymes. However, sometimes as we age, it's called a senile cataract, not that you're old.
Thank you.
And the metabolism of the lens slows down, and the internal and external factors, your eye, the lens, the metabolism isn't able to accommodate for filtering out all those proteins and enzymes. So there's abnormal clumping of the protein on the lens, which causes it to stiffen and cloud.
Oh, is that why my eyes look white?
Yeah. So I brought this picture that kind of shows how, so this is how a normal lens looks on the right over here.
Okay.
And with the cataracts, it clouds, so all the light refracts in a bad way, as you can see right there.
Is there anything I could have done to prevent this?
The risk factors aren't completely understood. However, it's thought to be that drinking and smoking increases your risk a lot, well as obesity. But
So the trifecta. Is it
Yeah.
common?
it is the leading cause of blindness in the world. In the U.S., it's less likely to ultimately lead to blindness just because of the resources we have here, and that's why we do that surgery.
So after the surgery, is there any chance that this is going to happen again?
Since it is an artificial lens, there's really ultimately no chance of that happening, but if it were to happen, we can just put in another new lens.
So while you're doing this surgery, can they do LASIK eye surgery too so that I can see and not need glasses anymore?
I don't recommend that. We try not to do those procedures together just because it can cause issues in itself.
Okay. Well, thank you so much for explaining it to me, Kat. I feel a lot better.
Of course, I'm happy to help in any way that I can. It was nice to meet you, and we'll
Thank
see you in
you.
a couple weeks.
Thanks. Well, hi, Dr. West.
Hello, Elise. I am Doctor.
Hi.
How do you feel today, Elise?
I feel fine.
Okay, my job's done.
Hi, Elise.
Who are you? Have I met everybody here now? Do you have results for me? What am I doing? What's going on? I feel like I've been here forever and nobody's telling me anything. And there's dogs.
Allowing you to see too well and replace it with a synthetic clear one.
Okay. What's the recovery time for this surgery?
This is not the
Hi, Elise. I'm Kat.
Welcome, Kat. Thank you for coming back.
I already came in once to this video.
Kat!
Hi. It's good to see you again. I'm sorry about Dr. West. He's an odd fellow.
He's not Dr. West. He's Dr.